I interviewed my friend Amanda Verschall. She's a technician where I work. I work at West Park Animal Hospital. I'm currently the receptionist, so I thought she would be the perfect one to interview. Question number 1 was, what are your daily tasks and responsibilities? Amanda responded, client communications, care of hospitalized patients, surgical prep, monitoring and recovery, dental prophylaxis, dental extractions, lab work such as blood, fecal flotations, urinalysis, cytologies, phlebotomy, which means taking blood from the veins, radiology, cleaning, and petting cat butts. Question number 2, what is a typical day like? Amanda responded, typical days are busy with appointments, surgeries, and emergency cases throughout the entire day. Question number 3, what are your typical hours? A typical hour at West Park is 11-hour shifts with a 1-hour lunch and 2 15-minute breaks if you would choose to take them. Question number 4, where do you see yourself professionally in 5 to 10 years? In 5 to 10 years, Amanda would still like to be doing what she is doing currently. She enjoys a fast-paced clinic and doesn't see herself changing to a smaller practice or office work. As long as her knees, hands, and back let her, she'll be rolling around on the floor with a big dog or scruffing a cat. Question number 5, what advice do you have for more in achieving my career goals in this field? Amanda said she suggests that you enjoy learning about the science behind the field. It's one thing to like dogs and cats, but it's another to truly enjoy making a difference in their health or well-being. Always continue learning and never be afraid to speak up if you have an idea or thought that may benefit a patient, client, or your practice. Question number 6, what is the most stressful part of your job? Dealing with overstressed or unpleasant clients and patients, for that matter, is always a hassle, but I find the most difficult or stressful thing for me is euthanasia. Everyone in our field deals with this differently, but since we are so high volume at West Park Animal Hospital, she finds herself very down a lot of the time. She understands very sick or very old animals and they deserve to be pain-free. It's when we have rescues, or most often the aggressive rescues, that are put down due to behavior that really bothers her. It's the thought of just not being able to help that animal in need that gets her down. But I know you have to look at the greater good, and giving time, effort, and funds to an animal that will find a good home is much needed. Question number 7, how do you deal with difficult parts of your job? She does different techniques. One of them is talking things out with the coworkers, venting, dancing, singing, and also eating a lot of chocolate. Question number 8, how did you get interested in this field? Amanda responded, Animal Planet. No joke, it was totally Animal Planet. Question number 9, what can I do now to gain experience in this field? Amanda responded, you already work at an animal hospital, so good job. Volunteering at the APL or ASPA, city kennels, anything in your community to help. It's always good to also volunteer with rescues, foster, donate, anything of that matter. Question number 10, is there much opportunity for advancement or promotions? Amanda responded, it depends on where you are working and what part of vet med you decide is right for you. You can work in a clinic and move up to head tech or more office manager type positions. If you work in a lab setting, you may be able to do the same thing there. There's also the research side of this field, and I know that there's a lot of room for advancement within those institutions. Question number 11, what are the most important skills for the job? Restraint, blood drawing, and IV catheter techniques. Above everything else, including client communication, you have to be confident in these 3 areas. In her opinion, anyway, you can't conduct an exam without restraint. That doesn't mean just choke hold every animal, but learn how to deal with each patient as an individual. They are not the same and won't be treated as such. And the ability to draw blood and place catheters is essential. It doesn't happen overnight, but practice is what makes it hard to get discouraged. But keep going. Eventually, it's like riding a bike. Question number 12. What sort of personality or characteristics are best suited for this job? Amanda responded by, be smart, caring, conscientious, confident, but never feel 100% complacent. Always be on your toes and expect the unexpected. Realize that everyone makes mistakes, and when you do, because you will, be forthcoming and admit it. Be honest and realize that you can move on and things get better. Question number 13. What do you wish you had known before getting into this job? She responded she didn't know how much poop she would have to clean up every single day, but that still would not change her mind. I had a really fun time interviewing Amanda. She's one of my favorite people I work with. I think she gave excellent answers. And thank you.